This is Breaking News.
We continue following breaking news for you on Spokane's Lower South Hill. A murder-suicide at the Deaconess Medical Center complex at 5th and Wall. KXLY4's Jeff Humphrey live near the scene. And Jeff, the shooting was at the Rockwood Health and Education Center building.
Yes, ma'am, up on the 7th floor. That's where about 9:48 this morning, other employees called 911 to say that the husband of a hospital employee walked into a 7th floor lab room where his wife was working, shot and killed her, then turned the gun on himself, was alive when paramedics reached him, but since that time has succumbed to his injuries. No other people were involved. No other patients or staff were inside that actual room. And the good news for people who have business here at the Deaconess Rockwood Health Center / hospital here at 5 in Lincoln, everything is open for business. Patients can keep their appointments. The only place that's locked down right now is the actual lab, which was the crime scene. We are told, Robin, unfortunately, that this couple had children, and now a police chaplain has gone to be with those children. We are told that police confirmed that no harm came to the children at any point during this shooting, but it is so regretful to think that a fellow that was having problems with his wife killed her, then killed himself, and now neither of those children have parents. Again, traffic flowing kind of smoothly now here at 5 in Lincoln, and most importantly, people who had doctor's appointments here at Deaconess can still keep them. Only the crime scene itself, that 7th floor lab where this man shot his wife and then took his own life, is closed right now. Robin?
All right, and Jeff, you pointed out how calm everything is now. Obviously not an active shooting situation. It was over and done very quickly, and it looks like traffic is moving smoothly.
And it's another interesting thing that you brought up is that this was the first time that we have seen the new fire department's tactical rescue squad at work. And these are EMTs and paramedics that have been trained up in special tactics. They also have ballistic vests and helmets. And the new way of attacking an active shooter situation is to let these paramedics and EMTs that have some level of safety because of their equipment to go in and render aid to these people. For a long time, you couldn't get emergency medical care until the gunman had stopped shooting or was down. Now they're trained to go into an active shooter situation with police and work hand in hand, reaching the first victims, rendering aid, moving forward. Even if the active shooter is still on the loose, we now have the benefit of getting emergency medical care in an active shooter situation. However, in this case, it was over very quickly. That's why as soon as police were here, they saw no additional need to remove other people from the building. There were no mass evacuations. There weren't a lot of workers in the street. This is just a very violent domestic situation carried out in a very public fashion.
Yeah, it is just heartbreaking. And Jeff, I know information is still coming in, and next of kin has to be notified, so we don't even know much about this woman who was shot and her husband.
Only that she was an employee here, not a patient. She was working in her lab on the 7th floor. He went in unannounced without making a lot of overt statements, went to the top of the building, entered her lab, her workplace, shot her, then took his own life.
All right, Jeff, thank you so much for your reports. I know you'll be needing to gather more information, and we, of course, will bring you the very latest right here, as well as on the radio and online. Again, a murder-suicide on Spokane's Lower South Hill at 5th and Wall. We'll be following that for you throughout the day today. Have a great day. Here's your regular programming.